to my dear friend who I entered Parliament with in 2010, the member for Waveney, who has set out the issues beautifully as always, with his sort of forensic ability that he is known for. I think people in Waveney are very lucky to have him, as is this House. So it was he who inspired me to speak in today's debate. He collared me in the corridor, as he often does, and I was only too pleased to do so, both as the MP for Winchester and Chalmers-Ford, but also as chair of the Health Social Care Select Committee, and indeed the former Pharmacy Minister. I have spent many happy hours sat in the seat where the Minister is today, answering debates on this subject. And we have moved on a lot, and credit to the Minister and the Secretary of State and this Prime Minister of all Prime Ministers. If they didn't understand community pharmacy, we were never going to get there. So credit to them for the investment and for the work that has gone on. It is, as somebody once said, much done, more to do. So I and my fellow members on the Select Committee, one of whom is here today, are all too aware of the challenges facing community pharmacies across all of our constituencies. But I think there is great cause to be positive, as I've said. They have huge untapped potential, in my opinion, to transform the way in which patients access and receive healthcare services, to support the building of a preventative healthcare approach, which the Minister knows I am passionate about, which is central, I would suggest, to the future sustainability of the NHS itself. Now, earlier this year, the Select Committee launched an inquiry into pharmacy. And I say pharmacy because while the inquiry will look broadly at pharmacy services, including hospital pharmacy, which is often overlooked and is very, very important in this sector, community pharmacy will obviously form the largest part of it. The terms of reference for that include specific questions around the funding, which we've heard mentioned by both previous speakers, around the commissioning arrangements in community pharmacy, which I know we will get onto, the locations of community pharmacies, and of course achieving the ambitions of Pharmacy First in the primary care recovery plan. And I trialled Pharmacy First in the North East when I was the Pharmacy Minister. I'm a great believer in it, and it's really great to see how this Minister has taken it forward. Now, a key question that we are seeking to answer, I suppose, in the inquiry is what does the future of pharmacy look like, and how can government ensure that this is realised? We'll be very forward-looking. We'll be considering how the challenges of today can be addressed to ensure the potential is realised. But we'll also be looking at the services that community pharmacies are already offering or set to offer through the Pharmacy First approach, which we've heard mentioned, and crucially, where there is a chance, I think, to go further. Community pharmacists are highly trained clinical professionals. They are not retailers. They are clinical professionals. They want to do more. They can do more. We should trust them to do more. We'll also be considering some of the innovations in the sector, for example, how automation and hub and spoke, which we haven't talked about much today so far, will come in and will help. And of course, we'll be looking at the workforce challenges, which we have heard of. And this will include issues around retention of pharmacies in the community pharmacy sector and around training. It will be very wide-ranging as an inquiry. We're looking forward to getting started with oral evidence, which we hopefully will do in November. There is no shortage of enthusiastic people, Samar, in the community pharmacy sector, willing to share their experiences with us. And we're incredibly grateful to all those organisations and individuals who sent in their written evidence. As I said, we'll be starting the sessions in November, and we will hope to continue that positive engagement from the sector. We've got the benefit as a Select Committee of drawing upon the work of our expert panel, which is chaired by Professor Dame Jane Dacre, who the Minister will know. Now, the panel, set up by my predecessor, the Chancellor of the Exchequer now, of course, evaluates the government's progress on meeting its commitments in an area that I ask it to look at, delivering a CQC style rating, I suppose, as to where we are, and that can range from outstanding to inadequate. I asked the panel to look, based on their expertise and their research and submissions by stakeholders, to look, as well as actually some roundtable events with patients, with people in receipt of social care and pharmacy professionals, to look at this sector. And they recently published their report on their evaluation of government commitments in pharmacy. Now, in their evaluation, they were assisted by several pharmacy professionals and leaders who steered their decision on which commitments to evaluate. Community pharmacy was, of course, an obvious area to focus on. They looked at two specific community pharmacy-related commitments, rating them both as requires improvement. it's a glass half full approach, is how I look at it, because I think there are very, very good things in there. I know the Minister will look carefully at it. Now, their first commitment was to maintain the Pharmacy Access Scheme, which aims to protect access to local, physical NHS pharmaceutical services in areas where there are fewer pharmacies. Often, the chemist will be the only shop in town. Often in coastal communities, that will be the case. The second commitment was to review the community pharmacy funding model and the balance between the spend on dispensing and the new services within the community pharmacy contractual framework, which is negotiated, of course, between Community Pharmacy England, formerly the PSNC, with Government and NHS England. The panel concluded that community pharmacies are struggling to meet the increased demands, which is a good thing that there is an increased demand because people are increasingly turning to the chemist. But they're struggling to do that. They're struggling to deliver services and even to remain open within some of the current funding model, which was set in 2019 for 5 years and hasn't been reviewed significantly during that time. Now, they are also struggling as their staff are encouraged to take up roles in primary care, as the Honourable Gentleman from Waveney suggested, funded by the Additional Roles Reimbursement Scheme. I think IT systems could make it very difficult for patient information to be shared, and the gentleman from Knowlesy touched on that, between community pharmacies and hospitals and general practice. And taken together, I think these challenges, they can negatively impact on community pharmacies' ability to deliver services and support other parts of the health and care system. The National Pharmacy Association, who've been mentioned, who do great work in this space, have been in touch with us. They commissioned an EY Ernst & Young report, which says that almost 3/4 of pharmacies in England face a risk of closure if a serious funding shortfall is not addressed, with 72% of them forecast to be loss-making within the next 4 years. Now, and the Minister will be aware of that EY report, and it is sober reading, but I think it would be wrong to overlook it. It is a serious piece of work. Just going back to the panel, they also raised concerns about the lack of data collected on the performance of schemes designed to improve community pharmacy services, especially in terms of whether they were delivering the positive outcomes for patients that we want to see and people in receipt of social care. So there's a lot for the government to consider in the panel's report, and we still await their response, which is not timed out yet, I hasten to add, and we look forward to that. A couple other points, Sir Mark, that I just want to touch on. I also chair the all-party group here, co-chair the all-party group in this place on HIV and AIDS. We are calling for the HIV prevention pill, PrEP, to be available through community pharmacies with clear financial accountability for its provision. I think this would be a game changer for HIV prevention. It would be a critical part of ending new cases of HIV by 2030, which the HIV Commission, which I commissioned as the Minister and then subsequently left government and became a commissioner on it, along with the Shadow Secretary of State for Health. Both front benches signed up to that ambition to 2030. The government have committed to it. And look, community pharmacy is very well placed to prescribe PrEP. They carry out medicine use reviews for patients, so I think they'd be well placed to counsel on PrEP and manage those prescriptions alongside other medications, because it's critical that is done in conjunction. They're well connected to other parts of the health service where integrated care boards have made sure that the IT is right and made sure those relationships are right through the ICBs. And I think there are services currently provided by pharmacies that act as a bridge between secondary and primary care, Sir Mark. So I think this would complement sexual health prevention and treatment services, the advice that goes on. And so I think from that point of view, they're well placed with PrEP. So just, can the Minister touch on, in his summing up, what progress has been made towards the commitment to make PrEP available beyond sexual health services, and when PrEP will be available in community pharmacies? Secondly, just on, we've talked a lot about the bricks and mortar and the workforce. Just on supply side, I think the medicine supply chain, which has been mentioned by both speakers, is in need of some serious love from ministers. Pharmacies often have no idea of the prices being charged by wholesalers on some key generics. So they've got no idea what is short, while pricing of products is often much higher when compared to other European countries. And consequently, margins within community pharmacy are often being eroded by this uncertainty in the supply chain. So I would urge government to look at a robust system to plan for the future pandemics and the shortages of key pharmaceuticals, because it is really undermining the sector and some of the great work that it does. There are so many things that we could talk about. The prevention inquiry that the Select Committee is doing, where I see pharmacy as playing a key role. But there has been so much that has been achieved. When I walked into the department, I asked the special advisors what should be on my worry list. And they said, general practice, Minister. Some things never change. But talking to the parts of the primary care sector, of which I passionately believe community pharmacy is part of primary care, or pre-primary care as I used to call it, talking to them as the Minister, they said, Minister, we want to do more. We can do more. We're trained clinical professionals who can be trusted to do more. And the government have picked up the mantle on that through the contract and through reform of the contract and new investment in the contract, and the Prime Minister putting his personal authority behind this sector. So there is much to be proud of, but we have to be careful we don't end up losing them. Because if we lose them, once they've gone, they won't come back. And then we're going to have a supply-side problem in the bricks and mortar, as well as the supply-side problem that we have in some of the pharmaceuticals. So thanks to the member for Waveney for sponsoring the debate. As always, it's an excellent subject for this House to discuss, and thank you for calling me Sir Mark.